With the touchstones of normal life vanishing before our eyes, the Senate late today approved the first interventions for Americans caught financially flat-footed by this pandemic. It comes as officials warn the number of infected Americans will soar, largely as the pace of testing increases. Hospital ships are now being mobilized to ease the strain on the medical system. The military stepping in with critical supplies. But the reality tonight is this crisis is getting worse, and what we do will determine how bad it gets. Let's turn to our team now for the latest. First, Miguel Almaguer.
Tonight, the American shutdown perhaps spreading faster than the coronavirus. Today, more city centers, small businesses, and rural schools shuttered as the illness spikes again, now reaching every state, infecting thousands and killing more than 100 nationwide. In communities big and small, the National Guard deploying to additional regions as more counties order a shelter in place, restricting public gatherings, telling families not to leave home unless necessary.
I'm just trying to condense my outside time to as little bit as possible.
The governor of New York says no such order is imminent for New York City, where the USNS Comfort, a floating hospital with 1,000 rooms, will dock next month, and where businesses are being forced to operate differently.
No more than 50% of the workforce can report for work outside of the home.
As iconic Detroit automakers like Ford, GM, and Chrysler, a symbol of American manufacturing, pull the plug on production, the U.S.-Canadian border is also closing to non-essential traffic. Even college commencements are being canceled, the president urging everyone to stay home.
We must sacrifice together because we are all in this together.
Facing a shortage of testing kits and an influx in demand, officials say those without coronavirus symptoms should not be tested. In Portland, Oregon, clinics are closing temporarily to prepare for an influx of patients. Doctors are worried over the next 4 to 5 days, a large spike in cases will be confirmed.
It wasn't like any sickness that I've had before.
31-year-old Laura Koch fears she has the virus, but says she can't get tested in Chicago.
Couldn't sleep, and I was sweating through t-shirts left and right. That even now, it's difficult for me to walk upstairs without losing my breath.
Amid an ongoing run on supplies at grocery stores, public schools across the country are handing out free meals to hungry students after closing their doors. The governor in Kansas announced classes are over for the rest of the academic year. California's governor said the Golden State, with its 6 million plus students, could follow suit. Justin Wilhite says the virus is nothing like the flu.
Nothing gets rid of the pain, nothing gets rid of the symptoms. Everything the authorities are trying to get you to do, I'm living proof of why you need to do them.
Tonight, our country entering a new era as we all witness the changing face of America.
In several cities and states across the country, the number of confirmed coronavirus cases actually doubled since last count. That's a scary trend we'll likely continue to see. And tonight, doctors say they are also concerned about the homeless population, where the virus could quickly spread and go undetected for some time. Lester.
All right, Miguel, thanks. And you mentioned that expected spike in the coming days. The nation's health care system is feeling the stress already. Healthcare workers desperate for protective gear, and those with symptoms anxious to get tested. Here's Tom Costello.
From the nation's hospitals to the White House today, an urgent rush to get ahead of a promised tsunami of sick patients. New York Governor Andrew Cuomo says the need is now.
This is the #1 device that we need.
The military now rushing medical gear, including 5 million N95 masks for civilian use and 2 million ventilators. The HHS national stockpile now rolling out. In Boston, a dedicated hospital will now only treat COVID-19 patients. Nationwide, doctors, nurses, and first responders are short on masks, face shields, and gowns.
It feels like nothing I have experienced in my 25 years in medicine.
University of New Mexico emergency chair Steve McLaughlin and his family are under home quarantine after he was exposed to a COVID patient.
We know that if we make a mistake with our personal protection, that we could also get sick, and that adds a really different level, I think, of anxiety to this particular event.
Some hospitals even making their own protective shields from trips to Home Depot, others reusing protective masks.
Virus can accumulate on those masks. Taking them off, putting them back on is of concern, and knowing exactly how to disinfect those masks is also concerning.
Tonight, the government reports 7% of those tested were positive, though as testing ramps up, the numbers will also move higher.
We will see the number of people diagnosed dramatically increase over the next 4 to 5 days.
But across the country, long lines for a test or no test at all. South Dakota is temporarily delayed. At an Atlanta area test site, our team kept 6 feet distance when Cynthia Eunice approached to say she had been turned away.
It's been very frightening. With the symptoms, I don't even go to the hospital no more. I just lay in the bed and put up with the shortness of breath.
The Red Cross also issuing an urgent appeal for blood. It's short 100,000 units.
We're creating a very, very safe environment for people to donate. We're sanitizing the beds after each donation. We have gloves. We're taking people's temperatures as they present at the drive.
Also tonight, the government is allowing doctors to cross state lines to practice in areas where they're needed most. And it's pushing pharmaceutical companies to develop therapeutics in the absence of a vaccine. Lester?
Hats off to those medical workers. Tom, thank you. Health authorities trying to stop the spread of the virus say they've got a growing concern that many young people are still not taking the threat seriously. We sent Kerry Sanders to the beach to find out why.
Alarming spring break images from Texas to Clearwater Beach, Florida. Today, as packed as ever, college students say they see the warnings, including to stay out of crowds, but
if I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
I'm worried for the older people, but not for me.
Coronavirus now exposing a generational divide, with authorities pleading for more young people to social distance.
We can't do this without the young people cooperating.
And just today, a new warning.
There are concerning reports coming out of France and Italy about some young people getting seriously ill.
Sobering news that's sparking even more outrage over images like these from a lung transplant survivor.
Self-centeredness of many who, oh, this is not going to affect me. I'm the younger generation. We're the healthy ones.
Some spring breakers told us they know they're in the spotlight.
Is the bad rap earned? I mean, are we seeing your generation ignore what they should be doing?
I mean, I'd say no, because I know our university is completely shut down.
Meanwhile, just a short distance from the beach, those most at risk.
You like the idea that we're doing the interview like this with this protection?
Yes.
93-year-old Shirley Acker told me when she was young, her generation would have heeded the warnings.
We did when we were younger.
What's the difference today?
They think they know it all. That's what I think. They think that they're better than the children were years ago. And we just listened. That's why I got to be 93.
In the wake of extreme criticism late today, the Clearwater City Commission voted the beach will close down, but not until Monday. Lester? Lester?
All right, Kerry, the battle to get everyone on the same page on this. Tonight, the Senate passing an aid package to help those impacted by the virus, granting paid sick leave to hourly workers and expanding unemployment insurance. But Wall Street tumbled once again today. Peter Alexander has details.
Tonight, President Trump casting this crisis as an unprecedented battle.
I view it as in a sense, a wartime president. I mean, that's what we're fighting. I mean, it's a very tough situation. It's the invisible enemy. That's always the toughest enemy, the invisible enemy. But we're going to defeat the invisible enemy.
And more details about one of the ways he wants to fight it, those checks to most Americans. The administration calling for 2 rounds of payments, the first to start going out April 6th, the second 6 weeks later. Congress is still negotiating, but it remains unclear how big the checks would be and who gets them. President Trump also pushing back on his Treasury Secretary's private warning to lawmakers that if the federal government does not act, unemployment could skyrocket to 20%.
I don't agree. That's a absolute total worst case scenario. But no, we don't look at that at all.
Meanwhile, tonight he's brushing off frustrations about how some of the rich and famous are getting tests before others.
How are non-symptomatic professional athletes getting tests while others are waiting in line and can't get them? Do the well-connected go to the front of the line?
Well, that you'd have to ask them that question. I mean, I've read. No, I wouldn't say so, but perhaps that's been the story of life.
Tonight, the president is also defending calling the coronavirus the Chinese virus, despite fierce criticism that the term is racist and stigmatizes Chinese Americans. His own CDC director saying it's inappropriate. President Trump tonight insisting it is not racist, but accurate, he says, because the virus started in China. Lester?
All right, Peter Alexander at the White House. And today's sell-off on Wall Street caused those so-called circuit breakers to trigger, essentially halting trading. It's the 7th time that's happened in 2 weeks. Some now wondering what is going to happen to our financial system and whether they should even consider pulling their money out of banks. Senior business correspondent Stephanie Rule is here. Stephanie, what should we know?
Lester, the markets might be ugly, but that doesn't mean your money in the bank isn't safe. The actual U.S. financial system is stronger now than during the last financial crisis in 2008. Whether your savings are at a traditional or an online bank, just remember, if it's insured by the FDIC, your money is as safe as can be. In cities where the virus is more widespread and movements are restricted, it is totally understandable that some people are taking a bit more money out of ATMs. And that is okay if it makes them feel better to have more cash on hand. But that is not really necessary, Lester.
All right, some important reassurance there, Stephanie. Thank you. Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.